Hello, Assalamu alaikum. Welcome to Scan Diagnostics. So this is the CVCT of the patient that you had requested. The area of interest is the lower left 8 and its relationship with the inferior alveolar nerve. As you can see, this is a horizontal and at an angle impaction into the ramus. This tooth has a significantly problematic trajectory. This is completely enclosed into the bony cavity. The inferior alveolar nerve, as you can see with orange, is inferior to the tooth. And as we move distally into the ramus, you can see what is more problematic is that we've got a rim of very osteosclerotic bone around the roots here, which go from the root PDL all the way towards the cortical plate of the ramus, which is very significant because it can cause ramus fracture or ramus damage at the time of extraction. And you can also see all the way the inferior alveolar, the apex of the tooth is close to the lingula, which is the opening for the inferior alveolar nerve, as you can see right here. So this is the axial view or the top to bottom view. Here you will be able to appreciate how the tooth looks from a top to bottom view, and you can see that both the right and the left teeth are impacted. The left, however, is quite significantly. It also has a radiolucency, which could be a cystic lesion. We will not be able to tell without a biopsy or a FNAC. So definitely there is a radiolucency or a pathology associated with the tooth, and along with that, the positioning of the tooth is quite complicated in relationship to the nerve, the angle of the mandible, as well as the ramus. In all these things you can see in this view as well.